Hi, I'm Dr. Tracy Tyson. I'm a pediatrician for over 20 years, and I want to tell you about why language in healthcare matters so much. I'm going to give you a very specific example, and then we can extrapolate this into lots of different things that are happening today. This is about the language around testing for prenatal HIV. So, in the United States, prior to the mid 1990s, there was something called opt in only for HIV testing. There was a lot of stigma associated with HIV testing. People didn't want to be tested, and there was all these criteria, like you had to meet so many high risk factors, yet we didn't fully understand how people contracted it, and numbers were skyrocketing. So, a mom who was pregnant would be presented with testing and said, you can, if you meet all these criteria, be tested for HIV. Well, what do you think happened? We had very low rates. Less than 20% of women in the United States consented to be tested for HIV during pregnancy, which could significantly decrease the risk of their infant being born with HIV during delivery. We started to notice that this was not a good thing, that this was putting stigma on the parent, this was putting too much stock in high risk. And what did high risk mean anyway? So state by state, but by the late 1990s, most states had adopted an opt-out procedure where a mom was given all of the tests that she would be eligible for during that first trimester, and they had to opt out of the HIV testing. So what do you think happened? 99.5% of women in the United States consented to be tested for HIV during their first trimester of pregnancy. That, combined with treatment, has led to one of the largest reductions in HIV worldwide of any country. We are less than 1% in the United States, even to positive moms. Because we know early, we can intervene early, we decreased the stigma, and we did not leave it all up to the mom to have to say, yes, I think that I want HIV testing. So that is why some of us are screaming for the rooftops that universality mandates, all of those things matter. They don't take away the individual's right to say, I don't want that, no thank you. They add true informed consent, which is backed by all of the scientific evidence and all the experts behind them, saying we believe that this is the best opportunity for you and your child, but we are here to ask questions. We are here to give you any information that you need, and you can choose not to do this. Just sign that you've gotten all the information so that we make sure you understand. So this is why this is important. This is why true informed consent is not making something so optional that people go, well, if it's that optional, why do I need it? The more you know.